is staying safe and well, though I will acknowledge that compared to the last two waves, it seems like so many more people have gotten COVID, though most, at least milder. It's not mild, but milder than the last two waves. So hope you're doing well. I'm Lisa David, President and CEO of Public Health Solutions, and we're delighted to have you join us today for the third and final session of our multi-part symposium series on integrating human services and clinical services with clients at the center. Just like the last two sessions, we have with us today a terrific group of truly multi-sector participants. We also have a small group of public health solutions staff who are with us to listen and learn as we conclude our series and to be able to build the feedback that we get today and the input that we get today back into the final documents. Some quick housekeeping things before we begin. Like previous sessions, this session is being recorded and we will share all recordings with you after the session. If you're joining us by phone, someone from our team will be texting you so that we can get your name and organization if there's just a phone number there. And for others, please update your screen name to your full name if you can, or add it to the chat so that we know who everyone is that's on the call today. So let me just step into recap where we've been. Many of you have been along with us from the beginning of this journey, but some of you are new and joining us for the first time, so I'm going to do a quick high-level recap. We started the symposium series in fall of 2020, amazing, with a big goal to bring together important stakeholders in New York City who individually work towards building a healthier city and to use our best practices and learnings to come up with a solution that would help us advance health equity in a comprehensive and sustainable way. In the aftermath of the early days of COVID pandemic, both the healthcare system and the landscape of social services and organizations in the United States were permanently changed. We were at a crossroads moment for change, and we still are. Today, even after 73% of New Yorkers have been fully vaccinated, the variants of COVID continue to upend our lives and businesses, and many of the issues from the early days of the pandemic continue to persist. Food insecurity, housing instability, and slow job recovery, just to name a few. The need for a truly collaborative solution is greater than ever. A solution that offers sustainable and coordinated approach to providing services, that bridges communities and systems of care, and is centered around a person's holistic needs. In our first session of the symposium series, we identified our biggest challenges in building such a system of care. Lack of closed loop referrals, a fragmented and siloed healthcare system that prevents the exchange of data and information, and issues around data collection, consistency, comprehensiveness, and actionability. In the second section of the symposium series, we went from challenges to take a deep dive into three innovative models that have already integrated healthcare and social services to positively affect the social determinants of health in their respective geographies. The models we looked at were 211 San Diego, the Camden Coalition, and Pathways Community Hub Institute, which is in several locations around the country. We invited speakers from each of these models to tell us what had worked well and what didn't, so that we could start using those lessons learned to design a solution for New York City. After the inspiring and thought-provoking discussions from symposiums 1 and 2, we formed a draft vision for New York City. It was clear that a citywide community resource network was essential to achieving health equity in New York City, one that would integrate healthcare and human services, one that would provide access that improves health outcomes for all New Yorkers, and one that commits to an equal role for community-based organizations and healthcare delivery systems decision-making that involves community resources. As the last step to building a roadmap, we hosted 4 expert work groups to extrapolate practical implications for developing such a citywide community resource network. Each work group included experts community-based organizations, healthcare providers, government, and technology representatives, and had in-depth conversations around investing in clinical resource networks, building effective clinical resource network lead entities, expanding local community planning and design, and creating a favorable technology ecosystem. At the end, we identified 4 key actions that will serve as the building blocks for the roadmap for improved health outcomes for New Yorkers. And these are: first, secure diversified, flexible, and sustainable funding for a citywide community resource network. Second, create an administrative backbone and infrastructure to support and facilitate the work of community-based organizations at all levels of capacity, from very small to large. Third, systematically build local community engagement and participation into the planning, design, implementation, and evaluation of the network. And fourth, employ regulatory methods and advance policies and practices that ensure a favorable technology ecosystem. So before we go into thinking about breakout sessions, I just want to step back and say, what are our goals in doing this work? Obviously, to design this clinical resource, community resource network, and what will happen with the roadmap when we're done. Our goals are to use this work to determine how to secure investment in community resource network infrastructure. Secondly, to develop policies that are going to, and advocate for policies that are going to advance health equity in New York City. Third, to be able to do smart implementation of all healthcare reforms being proposed. And fourth, to ensure better outcomes and, frankly, power for the intended beneficiaries and for the CBOs and faith-based organizations that are critical to providing the services. This group of organizations cannot compete with the strength, and I'm going to say this even though you're in the room, with the advocacy power of hospitals and insurance companies. And so this is to bring everybody together, have a point of view, and ensure that we're building communities and the landscape of community services organizations into the design of this landscape. So that brings us to the next item on our agenda, breakout sections. We have put together sector-specific groups to do a deep dive into the implementation strategies for each of these 4 key actions. All groups are going to be looking at the same scope of work, but they're going to be focusing on their own sector and their roles in doing this work. I want to take a moment before we go into the breakout groups to thank our advisory committee who guided us from the beginning in the planning of the symposium series. We are grateful for the significant time and their terrific expertise in moving this work forward. So the advisory committee consisted of Patricia Buzang, Senior Managing Director of Manat Health at Manat, Phelps & Phillips, Dr. Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health and Health Policy, Diana Mason, Senior Policy Service Professor and Co-Director of the Center for Health Policy and Media Engagement at George Washington University School of Nursing, Erin McDonald, Regional Administrator of the Agency for Children and Families at the U.S. Department of Health and Human Services, Tanya Shaw, a board member at PHS, and Abigail Velikov, Senior Director of Early Childhood Health and Development at the Division of Family and Child Health at the Department of Health and Mental Hygiene. So as you can see, we brought really interesting expertise to help us really conceive of and run this work. They've really contributed a huge amount of time, and the quality of what we have pulled together, it really rests on their input, and we thank them enormously. So for breakouts, each of you has already been assigned to one of 5 groups based on the sector you're in, as each group will discuss ways to make the roadmap actionable for your sector. All 5 sessions will be recorded, and we will be sharing these recordings with everyone after today's session. PHS staff will also be joining you in these sessions, which will run for about 60 minutes each. Moderators from each session will report out thoughts from the group once we come back together. So we're going to take a little 10-minute coffee break to gather your thoughts on the key priorities and begin to think about what you want to discuss about each key action that we will be discussing in our breakout groups. And we're going to leave that slide up for you so that you can think about it. Also let you, before we dive in for an hour of deep discussion, refill your coffee, go to the bathroom, but we really want to start promptly. You'll see a pop-up when you get back on your screen that will prompt you to join your assigned group. Please reach out via the chat box if you have any issue joining your group or you don't see that pop out. Our team is available for any troubleshooting and we'll put you into the right group. So we'll see you all in just a few minutes, and the breakout sessions will start at, I've done very well. I'm going to move that up. 10 minutes is at 8:55, 5 of 9.